So what's really new in the world of weight loss surgery? Well, I would say there are several things that are very new and very exciting in this field. The first is that we continue to see a march toward very minimally invasive procedures that are lower in risks, lower in complications, but also now demonstrably more effective over the long term. And when I say effective, I mean at helping people lose weight and substantial weight, but also keeping it off over the long term. And even more important than the weight loss itself is the data showing that a high percentage of people resolve their diabetes completely and improve many of the other health conditions that are beginning to occur or have already set in, including cardiovascular disease, breathing disorders, sleeping disorders, bone and joint ailments, and pains. So more specifically, what are the new things that have occurred in the last few years? Well, one is the growth of the laparoscopic or minimally invasive gastric sleeve procedure. The word sleeve means like the sleeve of my jacket, a long tube shape of the stomach, where the stomach is actually approached and about 75% of it is removed. So it's converted from a big expansile organ into a narrow, thin sleeve-like. Some people call it a banana-shaped organ. But the sleeve procedure has now emerged and been shown to be effective in at least 5-year data, being just as effective as the more invasive gastric bypass procedure. And many people find that it has less invasiveness, less complications, and they've gravitated toward it. I would say the other things that are very exciting in the weight loss surgical world have to do with the lap band. The lap band continues to be the most widely performed procedure outside the United States, so around the world in Australia, Europe, and South America. And that is because it is the least invasive procedure that has come along to date. It does not involve any cutting or reconnecting of organs or tissues, but involves a minimally invasive approach, placing a band around the upper stomach that can then be adjusted over time. As fluid is added to the band, it can be tightened to squeeze around the stomach and helps people feel full, feel less hungry, greater satiety. That leads to lower calorie intake and weight loss over time. So we now have 20-year data and beyond showing the effectiveness of the lap band as being very near to, if not comparable to, the gastric bypass procedure, which is more invasive. Even more interesting recently is the addition to the lap band a procedure that involves folding in the stomach below it with some stitches. It doesn't involve connecting, cutting, or stapling, but involves placing some stitches that fold in or imbricate the stomach. Kind of like the pleats on a skirt could be sewn together, the folds of the stomach can be brought together to make the organ smaller and have less capacity. So one of the most exciting innovations in the last couple of years has been placing the lap band and then placing stitches to imbricate or reduce the size of the stomach. In the early trials, this has been shown to produce faster, more immediate weight loss along the lines of the more invasive gastric bypass procedures. Time will tell whether this has the same long-term benefits that we've seen with the more invasive operations, but certainly in the early trials of it, we're seeing early rapid weight loss without any of the invasiveness or complications associated with surgery that involves cutting, stapling, rearranging, and connecting. So there are some new innovations out there in weight loss surgery. Perhaps the most exciting of them involves the continued advancement of minimally invasive techniques. And on the results side, many more long-term studies showing very exciting effectiveness with reducing, curing, eliminating diabetes.